Well, welcome to the Daily Brief on Metro Milwaukee's health and economy, brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce. I'm Tim Sheehy, president of the MMAC, and I'm joined by my fellow co-host, Dr. John Raymond, president of the Medical College. Each day at 3:30, we deliver a 19-minute fact-filled update on the health and economic impact of COVID-19. The webcast here is powered by Aurora WDC. And our guest today is Mark Cass, the editor of the Milwaukee Business Journal. And Mark will give us some insights from his readers here locally, as well as what he's hearing from his other papers around the country. And so we begin again with an update on what looks like to be some good trends from Dr. Raymond.
Thanks, Tim. As the listeners know, over the last 2.5 weeks, we've been tracking the efforts here in Milwaukee and across Wisconsin to flatten the COVID-19 curve. And we've seen steady improvement in that daily growth rate of new COVID-19 cases and in the calculated doubling rate. And that favorable trend continues today. Today, there were 67 new COVID-19 positive tests in Milwaukee and 129 in Wisconsin. Our daily growth rates improved again, now down to 11.4% in both Milwaukee and Wisconsin. And the doubling rates also improved, stretching out to about 6.1 days in both Milwaukee and Wisconsin. Now, I've been informed that several of our participants have calculated their own doubling rates, which appear to be more favorable using a straight line calculation method. I need to clarify that our statistics team uses a standard epidemiology approach to calculate the doubling rate. The numbers of new cases are fitted using a linear exponential curve, and the coefficient of that curve determines the growth rate, which is then converted to a doubling time. Now, I apologize if that seems esoteric, but I did want the participants to know that our calculation of doubling times is not a simple linear calculation. In any case, it's good to see a continuing positive trend. Now, is the trend enough to prevent a surge that exceeds our capacity? That's a critical question for health systems, the business community, and our elected officials. What I can say is updated projections from the Institute for Health Metrics and Evaluation predict a peak use of Wisconsin ICU beds that will slightly exceed our surge capacity over this weekend and continue to exceed that surge capacity through April 19th. Now, the validity of those projections really needs to be determined. What we must do and what we have to be able to do in the crucial week ahead is to develop our own local projections for which we're going to need more data. For example, hospitalization rates of COVID-19 positive patients, what percentage of those patients require an ICU bed, and the average length of stay in the ICU, so that we can project accurately using that doubling time how much our actual capacity is being used or is expected to be used. And I promise you that we now have those data available to us, and we'll be bringing those forward to you as soon as possible. We need to continue to monitor the situation very closely because the next few days and the next week are going to be crucial for us. And we are working with our health system partners to make sure we share those data with you in an enhanced scorecard. And I do want to reiterate, our health systems have done a tremendous job to create increased ICU surge capacity. As we consider what metrics are most meaningful in tracking our recovery and in making decisions about relaxing social distancing techniques, I request that you consider that our health systems can't maintain the current surge capacity indefinitely. Any recovery target should be based on the ability of our health systems to accommodate both COVID-19 and other patients with a reduction back to their usual ICU capacities. And please recall that the surge capacity was created by repurposing operating rooms, cardiac suites, endoscopy suites, and other procedure areas into ICU level beds. And those need to be restored to their normal operating conditions and purposes. If I could go skip 2 slides and go to the slide after that. I'm presenting a slide about herd immunity that was requested by listeners of a previous webinar. The Centers for Disease Control and Prevention define herd immunity as a situation in which a sufficient proportion of the population is immune to an infectious disease through vaccination or prior illness to make it spread from person to person unlikely. Now, some experts have estimated that for COVID-19, we need at least 60% of the population to be immune from COVID-19 to confer herd immunity. So why is herd immunity to COVID-19 relevant? Some experts and governments have proposed to relax social distancing to allow COVID-19 to spread freely throughout populations. Indeed, the UK tried this early and then reversed course when their health system began to become overwhelmed. Others have touted Sweden as an example of this approach. And indeed, Sweden has relied almost entirely on voluntary social distancing with some initial success. But they have seen that after that initial success, there may be some problems with the approach, and there's some rumblings that this may not be sufficient. If I could go to the next slide, please. This slide shows graphical depiction of herd immunity. And basically in the top panel, when no one is immune, infected individuals, shown in red, rapidly spread the disease to uninfected individuals, as shown in blue. The point of the middle and bottom panels is if more people become immune, it's less likely for the disease to spread. Now, ideally, that immunity would be conferred by a vaccine, but we know that's unlikely to be available here for at least 12 months. So then the discussion really revolves around whether we should allow people to become infected in the community. Next slide, please. So why not give herd immunity a try? We all know that social distancing has significantly challenged our economy in unprecedented ways. I do not think that's a good idea. First of all, we don't know yet enough about the behavior of COVID-19. For example, the prevalence rate of infection is unknown. There's not sufficient testing capacity to measure infections or to actually determine whether individuals have antibodies that might confer immunity. The actual mortality rate is unknown. And we don't know whether individuals who recuperate from COVID-19 have durable immunity. All these questions need to be answered. What we do know is that a sudden relaxation of social distancing is very likely to cause a wave of illness and death that will overwhelm the health systems, like what happened in the Hubei province of China, Northern Italy, Spain, New York City, and New Orleans. So my bottom line is the rip the Band-Aid off approach is a bad idea. On the other hand, it might be reasonable to find a middle path to relax some of the restrictions on key businesses and on our community in a graded, carefully considered manner. The timing and pace of that relaxation needs to be carefully considered. I do not believe that today we have sufficient data to make those decisions, but hopefully we'll have better data and more clarity as we roll out the enhanced scorecard early next week. So as we move into the next week and beyond, we're going to need to begin to address the issue of when we can and how quickly we can relax social distancing guidelines for certain sectors of our economy and for the public at large. So I thank you and turn the podium back over to Tim.
Thank you, Dr. Raymond. And again, I'll have to admit, I don't think I was awake during the linear coefficient portion of my math class, but I do appreciate kind of the detailed focus that you've had and the consistency. And so just again, as we're up to about 6.1 days, and I think you said the marker there was, 7 days on the doubling rate and then 14 days on declining new cases. Are those still fair markers for us?
I think they're fair, but obviously we're going to need to have a detailed discussion about what it means. And I think that it'll be easier for us to have that discussion when we have actual numbers of ICU beds, the capacity and the number of patients in there. And then we can use our trend analysis to make good decisions. And up to this point, we've been relying on third-party models and not really the best data that we can have. I think we have the access to that data now so that we can really focus on those important details. 7 days, I'd like to be there tomorrow. I'd like us to push it out even further because we really not only want to slow the rate down, we want to see declines in the incident cases that we have here.
Great, thank you. And I know you're going to stick around for questions, so appreciate the overview again. Mark, let's turn to you, and okay. You have your peers, editors around the country. So let's start there and tell me what you're hearing from other markets around the US, and then talk to us a little bit about what you've heard as you've gathered some of your subscribers together.
Really from around the United States, we've heard a lot of this impact has just been dramatic. I don't think what's happened here is very dramatic, but it's also happening in Atlanta, in Orlando, and in Phoenix. There's just been really hit hard, all firms, almost all industries. Here in Milwaukee, I've talked to a lot of owners. talked to a lot of executives, and kind of the thing I hear over and over again is everybody was shocked at the speed of this and at the impact. I mean, it hit them fast and it hit them hard. Obviously, a lot of restaurants have had to close or just have obviously the option of the carryouts, but really had to lay a lot of people off. I mean, I've talked to a lot of people who've lost 80 to 90% of their revenue over a weekend. I mean, it's just really, really impactful stories. But the thing I've often said over the past couple weeks was kind of nice is I've seen a lot of creativity out there, Tim. A lot of industries, a lot of executives who are trying new things and who are being very successful.
Mark, you've got some stories coming up that you are going to highlight how individual businesses have handled this. And we were talking earlier about the really difficult choices that companies are having to make.
Yeah, it's crazy. I mean, we're actually going to look at 8 small businesses throughout the Milwaukee area. We've talked to them over the past week, and then we're actually going to watch them over the next 8 weeks and actually speak to them, every day and every few days. But I talked to a couple of them, and actually one said, and this is actually magic production on Waukesha, they had to cut about 10% of their employees, only 10% of their employees, they said, but they had lost 90% of their revenue. And they're hoping it was the right choice only because all these employees are like family to them. We have another restaurant, or a restaurant in there, which I'm sure a lot of people know, called the Tandem. She has switched to a food operation, handing out free food in the neighborhood. She doesn't know if she's going to make it, for 3 more weeks, let alone 3 more months. They've had to make kind of choices on who to keep, who not to keep, just really hard choices. So, I mean, this is a hard time. And what's interesting is that no one has been prepared for this. I mean, how do you prepare for something like this?
Mark, any uplifting stories that you've come across in kind of this sea of doom and gloom?
There's a lot of great stories out there from individuals who have pivoted. I mean, I'll use the example of the owner of Sanford, high-end restaurant. He had to close at first, but then he reopened. He's thinking, how do I do carry out? How do you carry out with an average of, $80 to $100 a person? Well, he's now selling every night a meal for a family of 4 for about $60 to $80, and he's selling out every night. I think that's a great story. You have somebody like a lakefront brewery who closed at first, which is actually one of the first ones to close, who realized that he could reopen for fish fries because everybody wanted his fish. He sold out the first week. You're seeing other firms who have tried new things in terms of making masks or kind of making gowns. Others who are trying, I think that's the really kind of neat thing, Tim, is I think a lot of our executives, a lot of our firms in our area are trying new things that are going to last after this is over.
And maybe one last question before we bring Dr. Raymond back in, and both of you can handle questions. You had an interesting interview, it sounds, with Peter Fagan with the Milwaukee Bucks. A little insight into what you and Peter talked about.
He's a great guy. He's always very kind of insightful and really thinking forward. And, he's thinking about how does the NBA survive and come out of this? How does this look in fall? I mean, he's going to start a season next year. How many people are going to want to sit in an arena with 12,000, 18,000 fans? Are there going to be fewer employees that are going to actually handle the food because of our concerns there? How do you get individuals in and out of the arena? He has to think about all these things he never thought of. It's not like he's going to open the door and it's going to sell out every night. So and I think his experience really applies to someone like Greg Marcus, who I talked to, who said he's going to open his theaters. He expects he's only going to be able to have them half full at first. So I mean, there's so many interesting things out there, and kind of how people are going to react.
Yeah, great, very interesting. So Chris, we'll go to questions here as Mark has really teed up this discussion between how we open the economy back up in a way that is safe for both employees and safe for the patrons that are going to come to those restaurants. And so there'll be no shortage of questions for you, Dr. Raymond, as companies kind of walk back in to the next normal and how they do it in a very safe manner.
Yeah, Mark, I guess I'd be curious as to what you've heard on that aspect. What do the business owners you've talked to think about the idea of balancing the public health aspects versus the economic aspects?
Well, everybody wants to open and really wants to open quickly, but they all realize if you open quickly and then have to close again, it's worse. So I think everyone I've talked to wants us to kind of see the numbers that you heard earlier from Dr. Raymond, have this happen and then open again, because you want to stay open for a long term. Because, I mean, the issue that I've heard from many people is that it's not like they can just open the doors one day. You got to restock, you got to bring your employees back, you got to retrain people kind of on new ways to handle things. So it's, you know, it's got to be at a point where it's going to last.
Mark, another question for you. What are you doing to keep your reporters and your other employees safe?
That's a great point. We're actually, you know, all of our reporters are now, and all of our employees are actually working from home. We've put out 3 of our newspapers with our reporters and editors all over the region here, and it's worked, which I think is a great thing. But, you know, all of our reporters all of our meetings now are online or on the phone. They're no longer in person. We're doing everything exactly like everyone else in the region is doing.
We, of course, have several questions for Dr. Raymond. One that a couple of people asked about is the idea of immunity after you get COVID-19. Do we know anything about whether you are immune from getting it again, and if so, for how long?
We actually don't know. I'll just start there, but I did hear Dr. Fauci express some optimism that at least there would be some immunity that might last a few months, maybe into the fall. So that's positive, but you know, this is a new virus and we're learning more about it every day, and we've only been working on this for a few months.
Another question that a lot of people had was if there is any sort of negative effect from having an in-person election, when would that show up in the numbers?
Again, hard to say. A good rule of thumb is about a week. If you want to open the economy sooner, you're going to believe that it's shorter than that, but I think it's probably a week. The other thing that we really need to think about is what's going to happen this weekend when we have major religious observations and people are going to make choices to either socially distance or to congregate, and what impact that might have. So again, we're trying to be cautious and just think about what contingencies might influence the decisions that we're going to make. And we just don't know. We're in uncharted territory. What I can say about, I thought that people went to extraordinary lengths to protect themselves and to protect the voters at the 5 voting areas that we had here in Milwaukee. It was really remarkable that the extraordinary measures people took. So I'm going to cross my fingers and hope that there's very little impact.
Another question based on something you said earlier in the week. Do we know why West Allis may be emerging as a hotspot? And can you provide the website that the interactive map you mentioned is on?
Yeah, it's the Milwaukee Health Department website. If you just Google it and type in Milwaukee Health Department COVID-19, it'll come right up. That is a fantastic website. So I advise you to look there. I don't know. We probably need to ask our public health experts.
We did have one interesting question. I'm not sure what your perspective is on this, on the idea of treating COVID-19 something like altitude sickness and using respirators on a lower setting. Do you know anything about that?
I do. Normally when people have acute respiratory distress syndrome, you use high pressure ventilation. And the idea here is that that's actually the wrong thing to do. And there's a school of thought that if you use a lower pressure ventilation setting, that people will do better. Still unproven, but again, we're lucky here because we can learn from the lessons that the healthcare providers have learned that cities that have been overwhelmed before we had the COVID come to our region.
Great, thank you so much.
Good. Well, thank you, Mark, for participating and your interesting insights, both nationally and locally. And Dr. Raymond, as always, appreciate the update. I have a pilot friend of mine who told me in kind of looking at this crisis that when you're taking off, the runway behind you doesn't do you any good. It's the runway in front of you that you need to focus on. And so I think as we come into the next week, Dr. Raymond, kind of looking at those indicators that tell us to kind of extend that runway as we get set to take off with the economy is going to be very helpful. So again, the handouts are in your handout section if you're viewing this, so you can click on those and pursue the handouts. And tomorrow we'll get the case trends for the week and then be joined by the mayor of Milwaukee, Mayor Tom Barrett. So again, Mark Cass, thank you, and thank you for the work at the Business Journal. Dr. Raymond, thank you. Have a good, safe afternoon.
Thank you.
Thank you.